Thank you, Rhiannon. So I am now recording it. I will upload this. I just completely spaced on it. Luckily, I hadn't got that far into the content. For those that don't know, I want to make you aware. I am an at-risk individual. I have a rare primary immune deficiency. It is hereditary. My body doesn't produce critical parts of the immune system that fight off infection. I have severe lung damage to the point that x-rays are useless for determining if I have any damage. I have had the lower left lobe of my lung removed. So I'm very cognizant of risks associated with respiratory infections. So that is a little bit of background. Things I want to cover first, and I'm going to be going between the different screens for folks and sharing data. I apologize as I do that. I've got too many windows open to get through all of it. Okay, do folks see a web page?
I see a web page.
Thank you. So folks are aware on the website for the reopen draft, we have the links to the CDC data, how this is spread, their general opening plan, and the guidance for different aspects of what you do during a pandemic. So folks are aware, the CDC has set 3 phases for reopening. In order to meet each of them, you must meet the gating criteria. Phase 1 must have a downward trajectory of reported symptoms within a 14-day period. That is something that is not made publicly available, so I don't have data on it. But the next item I do, which is a downward trajectory of documented cases within a 14-day period. So that is new case downward trend, or a downward trajectory of positive cases to the total number of tests being done within a 14-day period. I have that data as well. Because I don't have that for Oklahoma, I am basing most of our guidance off of the new cases. We are going to be a little bit stricter than the CDC and the state guide. Well, we're going to be stricter than the state and be more in alignment with the CDC. The third is hospitals can treat all patients without crisis care, and they have robust testing programs for their workers. Both Texas and Oklahoma do publish their hospital capacities, but I do not have any way to estimate if they can treat crisis care or not. I do know that during Texas's reopening, they closed 2 general areas. One was due to substantial transmission. That was the Abilene area. Sorry, I may get the wrong city. It's Adler's Rue. So sorry about that. Those 2 counties had a significant substantial transmission. So the state had closed them down temporarily. They have since recovered. The other is in regards to hospital beds in the El Paso area. Those are fortunately outside of my jurisdiction as the Ansteorra and Marshall, so I will not be addressing them and following them. That is what sets up phase 1. At phase 1, I do not have all the criteria or all the information here. These are the things generally affecting the SCA. So all vulnerable individuals should continue to shelter in place. This is their recommendation. It is not a shall, it is a should. Social settings of more than 10 individuals where they cannot appropriately distance should be avoided unless precautionary measures observed. Precautionary measures include face masks, hand washing etiquette, and cough and sneeze etiquette. So that is phase one. Phase two is there's no evidence of a rebound, and they again meet the gating criteria. So that means they've gone another 14 days with those trajectories. At that point, they're still encouraging the vulnerable individuals to shelter in place. CDC guidance is that social settings of more than 50 individuals instead of 10. It's the same criteria of social distancing or protective measures with regards to that. To go to phase three, which both Texas and Oklahoma have done at this point. They did it on June 1st and June 3rd. So the Monday and Wednesday of last week. There is no evidence of a rebound, and they again meet the gating criteria. So at each phase, they have to hit those downward trajectories and have enough hospital capacity to deal with it. In this case, the CDC's guidance is vulnerable individuals can resume public interactions, but they should minimize their presence and or they should practice the physical distancing and the precautionary measures because they're at risk. The low risk populations, which is the majority of the people in the country, should minimize time spent in crowded environments, such as large malls, large parties going on. And when I mean large, we are talking more than 250 people by CDC's guidances. With regards to the state, let me make sure I'm going in the right order for my class. Yep. With regards to the states, we hit Texas on May 1st, announced phase one. They pretty much did the CDC guidance, except they limited outdoor sports to no more than 4 active participants. That means that they allowed golf and other activities, but they didn't allow basketball, football, etc. On May 18th, Texas went to phase two. They actually went more strict than the CDC's guidance. They're saying that we should still maintain those groups no larger than 10 without the additional protection, and that sports could resume without spectators on May 31st and competitions with spectators on June 15th. With regards to phase three, we entered that on June 3rd. They still encourage the vulnerable populations to stay home. The things that are related to the SCA that I could identify in the phase three, outdoor events are permitted, and they're defined at, large ones are defined as 500 or more attendees. At these large events, individuals should maintain 6 foot of separation from those outside their group or pod or whatever you want to call it, or maintain the frequent hand washing, face covering, and cough and sneeze etiquette. And adult recreational sports are allowed to resume with spectators at least 5 feet from individuals outside of their pod. Participants should consider wearing face masks. So they have actually reduced it at that point, because at this point, the CDC says face masks are no longer required. Some local jurisdictions may be requiring them. Enforcement is spotty across the state, but they are not required by the state nor CDC guidance. Oklahoma, on April 24th, they went to phase one. Oklahoma has actually had very minimal cases, and we'll see that here shortly when we start looking at a bunch of the data. They followed pretty much the CDC guidance at every phase. I could not find any variance from the CDC guidance for the Oklahoma. They went to phase two on May 15th and phase three on June 1st. Are there any questions on those data points? And please use the raise hand function so I can see it, because right now I can't see everybody's face. as I go between different screens.
That's raise hand, can't hit the button.
Okay, what's up? What question did you have?
Oh, sorry, I only heard the raise hand part. There was a bit of noise. I just wanted to make sure I wasn't.
Oh, no, there's in the Zoom, there's a raise hand. Please use that so I can call on people in order.
Oh, if you have
I
a
can't
question.
see people's faces as I go between my different data screens.
Thank you much.
All right, if they're, Miro.
So since neither Texas nor Oklahoma have actually met the CDC guidelines of decreasing cases for the requisite number of days to go into the different phases, they're just choosing to move to phases based on other considerations. How are you resolving that discrepancy?
That is actually incorrect, and that is my next data point.
Ah.
But thank you for being the straight guy for the conversation.
Excellent.
All right, I'm going to go ahead and move on to the next so that I can show why I feel that. Now I got to figure out which one is the right one. So these are the data trends for the month of May. Maroon is Oklahoma. The sort of orangish color is Texas. Unfortunately, burnt orange was too close to maroon, so I didn't use them for the official UT and Oklahoma colors. You'll see that Oklahoma, the dotted line is their trend line going downward over the month. The dotted orange line for Texas is a slightly upward trend. But this is where the testing data comes into play because it's an either or on the positive cases or testing data. For testing data, the ratio of positive tests to total tests has been on a downward trend throughout the month of May. Does that help show that they are actually meeting those trend lines?
I think so, yes. Thank you.
You're welcome. I'm gonna go ahead and lower your hand unless you have another question.
Oh, yes, sorry, I didn't know. It was so
Nope. I try to let people know I'm gonna do it though. Are there any additional questions about the trends that Texas and Oklahoma are seeing? I do know there was a lot of confusion out there because the media is really into selling the hype around this, not necessarily the overall time. So they'll come in and say, on this date, we had this huge number pop up. But that's because it's a single point in time and not a trend over time. All right, I got to see what my next topic is. Aha, now I got to switch back to the other screen. Excuse me a second. There has been edits of this over time. This plan has been in process for more than a month. I've sought out the input from various people across our kingdom and across the SCA. That's included risk management people, doctors, including a COVID doctor, and other data analytics people, because there is a fair amount of data analytics involved with the analysis of this. Making sure that the formulas are right and we're not misrepresenting the data in any form. Because data analytics can be misrepresented, I'm trying to be as true as I can to it. With regards to the plan in general, after talking to people Friday night, there's been some slight changes to how we're presenting the data because it was too confusing to people. For those who are interested in the data analytics aspect of it that was used to get into the background of it, it is on the website as a link just below the branches. So you can open that up and it'll show you different red light, green lights for different types of data we were analyzing. And I'll talk about those after we go through the plan of how we got to the data we get. But in general, we're going to have The report's going to be published weekly on Fridays. There's a key reason for it being on Fridays. As we were doing data analysis, because of the trickle up aspect of the data going from a county or city, county, state, national, we want to make sure that we are accurately catching the data, particularly what happens over the weekends, which were not always being reported in a timely fashion. The data we are using is actually the same data the CDC is using. For that, it's off a group called USAFacts, which does data analysis and consolidation for the US government. We'll see a use of the data of that here in a little while. But we'll be doing that on Fridays so that we're not misrepresenting any of the recent trends that happen because of weekend reportings being slightly behind. The data will be valid for the following Monday through Sunday. That gives people enough time to make sure that if they need to cancel practices, they can. We don't want them to be announcing it on Friday that a Saturday practice has to be canceled. So we're predicting that into the future a little bit. But each week, the state can change. We will be communicating that. Yes, Mira?
I just noticed the minors under 12 is a little bit further down than you're at right now, but when you get there?
Yes, and I have no problem with that. It's something I got to work with the live weapons folks on to make sure what we're doing.
Okay.
All right, so I'll call on you when I get down there.
Thank you.
With regards to the status groups they can be the red light. That means no activities are allowed. They cannot travel to other branches. Phase 1, we're allowing target archery, thrown weapons, and equestrian. No combat. So no mounted combat, no armored combat, no fencing combat, no youth combat. In phase 2, branches open for all adult martial practices. This is where Miriam's comment may come in. We're allowing that for target archery and live weapons or thrown weapons, not for youth martial activities. Does that clarify it?
Yes, that is exactly what I was concerned about. With the
Okay.
more ranged activities, I'm less concerned.
Yep. And we picked the age of 12 because they can generally be old enough and the activity is controlled enough. We are considering that we may not allow them to do those activities, but we will see as we go through the practice on the enforcement of that. With regards to phase 3, we are reopening all martial activities, adult and youth. That is also at the phase that the SCA or the Kingdom will start consider having events again. So you've seen the announcements for Queen's Champion and Crown Tournament. Those are not a given at this point. We are in phase 3, but we are still watching our trend lines for data. Well, the states are in phase 3, the Kingdom of Ansteorra is not. We're watching the trend lines to make sure. There has been concern raised because of the additional exposure associated with people going to amusement parks, going to lakes and rivers to do activities, as well as the recent protests. We are watching that data. It doesn't seem to have a significant impact yet, but we will continue to watch that. At this point, we will not be opening on this coming Monday. That call was made Wednesday night, but we did not announce it out to folks because we said the earliest would be Monday. That didn't mean we would open. We're still waiting to determine what date it will be opened. Is Kingdom Seneschal, the Crown, and me will be discussing that here in the next couple days. One of the key things we want to do from this is to get feedback on the plans because of the impact it has to combat and the heat elevation for Ansteorra summers. So we want to have enough data to have those events. So we do want to open soon, but we don't want to open too soon with the risk potentially around. One of the things that was brought up by a couple areas is we are going to allow branches that hold joint practices they can open at the lowest phase for their joint practices. In general, that's not going to be very, those aren't going to vary a lot based off the data we've seen so far, but we're playing on the side of caution with that. I'm not going to read all the rest of this because of it's administrative, but I do want to point out that if we have any people showing obvious COVID symptoms, they need to be asked to be removed. We do not want people to put themselves at risk. So if a local marshal is unable or unwilling to attend, they should take reasonable efforts to deputize someone. Cordelia?
Okay, one of my people here have a question.
Hey, you're most awesome person. So, I have severe allergies during this time of year, and it makes me cough, sometimes sneeze, and a lot of the similarities of my symptoms are similar to that with COVID. However, there's no fever, nothing like that. Where does the line actually draw for that? Because some of us, I don't know if you have allergies. I get seasonal asthma.
I do, yes.
And sometimes, you just get to a point where you're out of breath. It's not from anything besides DNA.
Yep. So to let folks know on that, there is a health screening questionnaire we are going to have around. It does say cough not associated with seasonal allergies and sinus issues not associated with seasonal allergies, because we do live in Texas and Oklahoma where they exist pretty much throughout the year for different people.
Because they hate you. Thank you,
So
sir.
that is there. We don't want, if you had the fever and the sweating associated with it and one of those, we would ask you to leave. But if it's only allergy symptoms, that's a reasonable thing. Any other questions?
Thank you.
Right. Eleanor?
Hi, thank you. Our group is in somewhat of a quandary because all of our marshals are at-risk individuals or are living with at-risk individuals. These are both officers as well as non-authors, such as myself. I'm a thrown weapons authorizing marshal, but we don't have a group thrown weapons marshal. So what do we do? I mean, we can't just deputize somebody without them already being some form of a marshal.
Certainly true. And in those cases, we acknowledge that some branches may not be able to open practices if there are not acceptable marshals and enough participants. We don't want people putting themselves at risk. We want the local group that when that happens to communicate upline that they are not able to do it, but we do not want people putting themselves at risk.
I've already communicated this information to my upline, the Central Regional Seneschal. Is that sufficient?
That is sufficient. I will make sure Avery and I work together to gather all that data.
Thank you.
Thank you. The other thing that we want to do is there are some situations where the local marshal is unable to because of they may be an at-risk person or they are risk adverse. If we do have 4 or more marshal participants of the same form, they may petition for consideration on resuming activities, but that still means we have to have a acceptable marshal, we have to have a local officer, all those other aspects must be met to hold practices. But we do want a petition path so that a single individual did not cancel all activities when there were people willing to do it. But we don't want anyone putting themselves at risk. One of the key things that we are worried about is enforcement of this and or potential bullying because of the different aspects. We want those to be reported up immediately, stating the details, and appropriate action will be taken. Right now we are doing it on a case-by-case basis, but we will probably be coming up with guidance for that. We don't want people to use their status as a form of bypassing the fact that they need to keep our populace protected by avoiding, but so they can't avoid the safety measures we're putting in place for this. Any cases of suspected bullying, such as people trying to force people to go to practices or force people not to go to practices, should be reported up through the Kingdom Seneschal for investigation. And I made sure to put in rule number 1 is always in effect. For those who don't know, rule number 1 is don't be a dick. That's actually from Will Wheaton, going back a few years. Our rules may be stricter than the local government, but if the local government is more strict, you have to follow their guidance. We can't possibly know the guidance of every county and city within the kingdom, so we are depending on the local people for that aspect. One of the questions that came up in Thursday night's meeting was if we would be providing additional assistance with them to determine how we're classified in their local government activities. So folks are aware some of the different aspects of this are opened up by type, such as gyms, outdoor sports, sports leagues, etc. So we will work with them to determine that when they need assistance. And that'll be done through either myself or Avery, depending on what the circumstances are. In phase 1, reiterating what is and is not allowed, we are limiting a group of the participants to 10. You can have multiple groups at a single practice as long as they can maintain a clear separation of at least 10 feet to make it obvious they are not one big group. And people should minimize their interaction between groups. We don't want people cross-contaminating, for example. Because of the restrictions, we are limiting it to no more than 4 individuals actively participating, so no more than 4 shooting archery at once. You can then take turns shooting, but only 4 at the line at once. And they have to keep distance between them each other of at least 6 feet, if not 10. All individuals must wear face masks covering the mouth and nose or equivalent. There are commercially manufactured or there's CDC guidance on how to make them yourself. I'm sure plenty of people have seen those on YouTube and various places as well. When you're unable to maintain the 6 feet of separation outdoors, you should use proper hygiene and cough sneeze etiquette in addition to the face mask. Before participating, you'll have to acknowledge a health screening questionnaire. That has the questions with regards to it. Let's see if I can do this correctly. So, are you experiencing the high fever, persistent cough without season or allergy symptoms? Are you experiencing any of the following that is not normal for you? And so forth, so on. Have you been exposed to someone in close contact with someone positively diagnosed with COVID-19, or have you visited one of the US's restricted countries in the last 14 days? Brenhofer? I don't know if I pronounced that right. Bren?
It's Brynjolf, Master Pug. How are you?
Okay, it's good. What's
Okay,
your question?
so I have a few.
Okay.
Some of them, some of the guidances don't necessarily jive, at least in my mind, that are conducive to being, that are in line with heavy fighting. For example, the 6 foot guideline, is that waived when people are in the middle of bouts, or are we just fighting with great weapons or spears? And the second part of that is, are we going to be fighting face masks like the entire time? Is this something new that we're doing forever and ever? Because at least, and this is my opinion, if we are still in a point where we are wearing face masks, would it not behoove us to maybe open a little bit slower? That's my take on it. But that's my biggest hang up with everything that you've got going on at
Not
this
a
point.
problem.
Now,
So to let you know, if any group is in phase 1, they are not allowed to do combat. If I go over to phase 2, you'll see that they're allowed to do combat, but they must be wearing a face mask or a plastic face shield that covers the same area. So we are allowing it. That is in alignment with other sporting activities that are going on. Part of the reason we want to try this out at practices before we get to some large event like Queens is that we want to see how that works for playability in Texas and Oklahoma. We may have to cancel events if it is not safe to do the activities. There have been individuals who have unofficially play tested these in backyard practices. That does increase your heat a little bit, and you definitely learn to do proper breathing technique. But it is certainly playable at this point. But we need to get more data gathered for it. Does that help? Kat or Orlando, I'm not sure which you are today.
Hi, it's actually both of us.
Okay.
I have a question about loaner gear. So what is the stance on, say, for thrown weapons or archery? We have somebody using thrown weapons and then they put those loaner weapons down and someone else comes and picks them up. Are we okay with that?
So in phase 1, we are not allowing the use of loaner gear. As we go into phase 2 and phase 3, they are allowed as long as they're properly disinfected between uses.
Okay.
A sample disinfectant is Lysol.
Okay.
That is one of the CDC approved one that kills coronavirus.
Perfect. Thank you.
And groups can choose to not have loaner gear available if they want, but if they do use it, it must be properly disinfected between.
Okay, thank you.
Cordelia?
The face masks, are they full face, the plastic full face, or is it just covering your nose and mouth?
It needs to go up high enough that it covers any respiratory stuff coming out. So it needs to be at least mid-nose or higher. The ones that we did were full face. We put them inside the mask and helm and just taped them in. They were simple, cheap file folder plastic. That was
file folder plastic.
Yep.
Okay.
It has
All
to be
right.
something that can stop the transfer. It can't be perforated plastic or anything
And this can
like
be
that.
mounted inside your shield, your face shield, right?
Yep. That is actually probably the preferred method, so it can't accidentally get knocked off.
Hey, Thug, it's Galen. Can I show you something?
Sure. I got to get back to you, but sure.
Yeah.
It's right here.
I'm with Cordelia.
Well, the problem is I can't see people.
Okay.
Oh, okay.
Hold on, I'm getting there.
Okay.
All right, I can now see people.
All right. Can you see me?
Yes.
So I'm showing you my helm with the cut and thrust mask.
Yes.
And I put duct tape inside to cover the lower breaths.
I would consider that sufficient.
Thank you very much.
Thank you.
All right, let's see. Next was Mira.
Let's see, was that me?
Yes.
I'm somewhat concerned about the equivalence of a face shield versus a cloth face mask. The shield would deflect particles, but it wouldn't filter them out. So I'm not entirely sure how useful that's going to be.
I understand the concern. We do know sports are doing that, and from the practice we've had with them, what you see is it is obvious how much respiratory particulates come out while we're fighting, because it'll actually be covered in them and they drop out. Those that become aerosols, there is a potential for it, but right now we're doing alignment with other sports activities that seem to be using the same thing. Some of us are going to be trying additional face masks, such as some of the sports face masks used for cycling, to see how those work, which are vented, but we'll have, until we get those in, we don't have recommendations on those.
Right, all right.
But I understand the concern, yes.
Certainly, thank you.
Grace Gabriel?
Hey, good afternoon. I got two questions about the health screening questionnaire.
Yes.
The one is, which officer is responsible for asking that? And the other is, what records are we keeping on it?
We are keeping no records. We don't want to get any risks associated with identification of personal identification or health tied with health information, even though we're not covered under the HIPAA guidelines. We want to skirt that completely. It will be the marshal in charge of that day will be responsible for screening. And it's going to be a simple piece of paper. People look at it, answer yes or no, and that we go from there.
Thank you.
All right, Brendel again. God, I'm going to slaughter your name.
It's fine, Master Pug. You get it one day. It's okay. So I have a few concerns as well, because it seems like if we just put guidance forth saying if you have these symptoms, don't show up, that keeps us much safer legally than showing a piece of paper and having someone respond to the affirmative or negative to that. That's a concern I have. The other one revolves around cut and thrust as well as the heavy stuff. Are we not concerned that the face mask could shatter and cause like projectiles in the eyes? And additionally, if we're fine with the duct tape that Master Galen had, would we then be okay with like a lined aventail that covers, from the eyes down?
That came up the other night. It will depend very much on the grill itself, on how much it has and how much perforation there is. We're looking to eliminate that perforation where the respiratory will be coming directly outward, so that it hits something and falls. That is the whole goal. Okay,
and so regarding the health questionnaire as well as the potential to shatter the face mask, do you have any thoughts on that?
The health screening, people already have the guidance to stay home, so we can reiterate that. But this is a normal health screening that any business is having with regards to if you go to a doctor's appointment or something like that. They have additional measures that they can do, temperature screenings and stuff that the SCA will not be doing, because we don't have, we're not going to be owning medical equipment. That is something that has come down from society years ago. We think this satisfies the need of making sure that someone is safe when they show up. That way we have a positive affirmation that they are not currently experiencing those. With regards to the breaking of the material, there is very minimal risk on the inside of the face mask. On the outside, there is a slight risk, particularly on the chivalric side. That is why we're encouraging the inside, but each scenario and each helm is going to be different. So I can't make a universal ruling. Marshals are going to have to look and see, does it appear safe or not, with regards to breaking and stuff like that. Thank you. All right, I'm going to finish up phase one. We are looking at doing electronic signatures for waivers. We have gotten guidance from some doctors, though, that is probably excessive and not necessary, but we're looking at still doing it. We're pending that if that can be implemented and if society is going to sign off on the method we're doing it. But paper contact is very low. It is all respiratory. Some of the doctors even thought our use of denying use of loaner equipment may be excessive, except for potentially the hoods and stuff that were nearby people's where they could inhale it. When performing inspections, both people must be in a face mask or equivalent, minimizing contact, and they should properly disinfect their hands before and after. When feasible, inspect the equipment away from individuals, just so you're not having that additional exposure. Although outdoors is very low, we want to reduce it as much as possible. And no shared food or drinks are allowed through any of the phases for martial activities. In case it wasn't obvious when I mentioned it earlier, this is only about martial practices, not events. There'll be separate guidance that comes out for events that may have some of these, but it'll have additional ones as well. We're encouraging groups to make available face masks for those members who can't afford them. and antibacterial hand sanitizer. One thing we need to be careful with, though, is that we don't use it excessively because it can dry your hands out and cause cracking, but most people should be aware of that by now. And we're strongly encouraging at-risk individuals to stay home. We are not going to enforce it. We can't know if someone is an at-risk person. And even the ADA and others don't allow you to ask. So we're encouraging it. We're not going to try to enforce those things. As we go into phase 2, we have all adult martial activities resuming, indoors or out. Indoor limits will be determined by the facility owner. We can't possibly know what classification they fall in. We're going to let them determine if we're allowed to do it or not. Outdoors is by far the preferable based off all the current guidance. Here's the discussion about the minors only participating in live weapons. I'll make sure to copy that verbiage up above so it's more obvious. In Texas, groups are still limited to 10 in size. You can still have multiple groups at one practice, and we're still limiting the attendance to the participants, combatants, marshals, and required officers. And when minors are present, 1 adult. Oklahoma, because they're following CDC guidance, they're allowed to have up to 50 outdoors. Indoors is going to be determined by the facility owner. We are discouraging non-participants. We are not saying they are disallowed because they are allowed by it. Texas is just being more conservative, which is a bit odd to me living in Texas, but hey, I'm all for it. We're going to allow melees only up to 5 combatants per side. That number was completely arbitrary, dividing 10 by 2. We still keep wearing face masks. We keep maintaining distance and hand and cough sneeze etiquette. We still have the questionnaire, and we still have all of these aspects of it. For somewhere in here, I've lost, oh, it's down here. That's why I haven't done it. When we have the combatants wearing face masks with a solid plastic face shield or equivalents covering the mouth and nose, if they see an extended close proximity, particularly on the armored combat field, we want to have marshals and combatants break those up. We don't want people being close together, doing heavy respiration at each other for an extended time period. There is a lot of numbers out there of what's okay and what's not. We're just wanting to break those up. That can be for, I'm not even going to say an arbitrary number because then people take it as gospel. But if you see something that looks like it's gone on too long, break it up. And all the rest of that is the same. Phase 3, we're resuming activities fully, adult and youth. We're still disinfecting the loaner equipment. We're still saying no food or drinks. We are still, despite some of the local guidance, we're still, until further notice, we're going to require people to wear face masks at these activities. And just in case we keep them separate, we have the same verbiage for the combatants, not just the spectators and others, in case we separate those when we do a decision to disallow it for, say, spectators. Any additional questions I had covered in the earlier ones? Yes, Your Grace. Gabriel.
Hey, I think you mentioned earlier, but I didn't hear it. Where is the actual status for each group going to be listed at?
Actually, I'm covering this, and then I will go to that, but it's on the same webpage.
Okay, thank you.
Muriel?
You may not actually have a policy on this, but can anybody be the one to disinfect loaner equipment after it's been used once? So could the person who used a set of archery equipment be the one to disinfect it, or does that need to be done by the marshal? Or
No, we are leaving that up to the local group because each group will be different. Each martial activity will be different. We're just requiring that it be disinfected.
Sure, makes sense.
As appropriate for whatever the material is.
Okay.
And there is a link on that disinfection to find out what the CDC guidance is for all the different materials.
Yeah, perfect.
Right. So now on to what everyone really cares about. It's now moved up into this document. So right now you'll see, right now we are not reopening because we're still in draft form. But if we were, these would be the different phases. So it will be kept here. What I want to show you now, though, is what went into this. Of course, I've got to get my Zoom to behave. All right, does everyone see an Excel spreadsheet?
Yes.
All right, so now I'm going to bore you to tears. This first tab is the USAFacts data downloaded on, I'd have to scroll over to see it, but it was on Friday. So it covers through the day before. They update their data at midnight. This has every county of every state and every territory of the United States. This is what we're using as our source of truth to determine. This then goes over to a COVID, over to another data place where by branch, we tie a county to a branch. We have the population from the most recent census for that county, and we have the going out through time, what the case count was on any particular date for each of these counties. We're going to ask the groups to confirm that we have identified the correct counties and if we need to add or remove any. But this was done with the Kingdom Seneschal. We have one down here for steps that's orange because it's for county for a group that's now in a hiatus. So we're tying it to the parent barony until we get it identified or until they come out of a hiatus. We move up through this tab to what the daily change is for the group. So we go for the group, we go down and we sum these together, we subtract them. That gives us our daily change. And it goes out for 3 months going out to that direction. Because of some of the concerns people had with the dailies were kind of erratic in their numbers, particularly early on because of some of the reporting, we did a 3-day change. So that's averaging the 3 days out to sort of smooth the graph. We have not found that this has a very significant impact in our data analysis, but we have it here just to help people to understand it. As we move up, we now get into what is called a trend line, and this is the weekly trajectory.
Because of this conversation I have to listen to.
You do? Yep. So as we get into the trend line, we figure out what the line is for the 7 days.
367. 367.
Hold on, I'm going to mute whoever that is. Assuming I can figure out how to get back to my screen. They stopped talking, that figures. So now I can't identify them. All right, back I go. This is done for weekly. If it is green or negative, that means it was a positive trend for that week. In other words, downward. We have fewer cases on average as it goes. If it is white or above 0, it is a slight upward trend. The yellows are very slight upward trends. Whites are, they did not fall into what we use as an arbitrary upward trend. Part of the reason we have this slight upward trend and some logic around populations is that we were having groups that had 0 cases, and when they suddenly went to 1 case, that was a significant increase of the trajectory. but going from 0 to 1 is not a significant thing. So we had to build some fuzzy logic in with regards to that. As we go up, we then do, this is the branch, this is its total population, the total new cases for the last 14 days, and then what percentage of their population that is. I will get to what the coloring is, what the numbers are to do the coloring, but green is generally considered good, which means it's less than 2 in 10,000 people. And red is generally bad, which means it's more than 3 in 1,000 people. For the 14-day trajectory, that's the same information as before. It's just over 14 days instead of 7 days. We have a override here where we can put in the group is closed by either state, tribal, government, or self. Oh, Joffrey's got a good question. So what happened to Ravensford? One of the things I didn't show the other folks the other day because it took so long is one of the pages on here are all the trend lines so people can see it. And my guess is exactly what Master Brian put out, which is we think it's associated with the prison there, and they suddenly reported cases due to local outbursts. So this week they had over 241 on a single day, followed by 153. The next week they had over 500 on a single day. So this was very significant. This actually aligns pretty closely with how Adler's Brew was looking when they had the meat processing facilities have get infected and start spreading around the community. But we will keep an eye on it, and the good news is when these types of things happen, the data analysis will close the group down automatically. I've kept an eye on this for more than a month, watching different things. And what you've got to be careful of when you look at the charts is the scale of the chart. So Mergenfeld is only 1 case in the last 2 weeks. So, but if you look at that compared to others, you may get confused if you don't pay attention to how many. When we get over here, we do the business logic or the logic for it. So I talked about the percent of population. And I've lost my picture to see who's raising hands. So just a second. This is the challenge I have with these meetings is I have too many windows open, so I lose track of people to see if they're raising their hands or not. All right, now I can see all of you again. Eleanor?
Yes, thank you. I tried to download this document an hour before the meeting, and I couldn't see any of the fields filled. It was just zeros. Is this because I'm a Mac user?
No, because I'm a Mac user. In just a second, I dropped my headset. No, I am a Mac user. It could be a challenge because I'm using some of the newer features of Excel. Particularly Xmatch and XLOOKUP. I will take a look at that and see if that is the reason for it.
Can I make a request that you have a copy that's viewable on Google Documents or Google Spreadsheets?
I will see if they have the feature sets that we need. I will write that down though.
Thank you.
Or maybe all else failing, you could just make a version that's exported to a PDF just so people can.
I definitely could do that, except that last page, it goes on for miles.
True, yeah.
All right, Muriel?
Could you just help me? I'm having a little bit of trouble understanding what are the numbers actually representing in the weekly trajectory section? Is that a slope of a line? Is that?
That is a slope of a line, yes.
Okay. So when it's green, that's downward, but that doesn't seem to correlate with the size of the number necessarily.
No, the size of the number is kind of arbitrary based off what their cases were. Part of why Adler's Brew has such a big number of -56 is they actually had over 200 cases and 500 cases a couple weeks before that. And so when it suddenly went from that almost to 0, that slope over that 14 day or the 7 days in this case was very negative. but it is about the slope of the line.
Okay,
And if you
okay.
go
So the
to
green
the-
ones are negative slopes. I get it.
Those are negative slopes, so therefore they're good for us.
Right. Okay.
Not
Sorry.
not the accounting negative where it would be red.
Right. Okay.
Right. Asta or Havar?
Yes, Master Plug, for the places like Ravensfort and Hell's Gate with Coryell County that have prisons, are the numbers that are in the prisons, is there going to be anything to do to change our statuses? Because for like Coryell County, I think it was 43% of the cases in Coryell County are in the prisons themselves.
We have not looked into any additional logic with regards to that. We have found that most of the time those drop out fairly quickly because they're clustered together. And then the slope will even out in a few weeks. With regards to Hell's Gate in particular, there are enough counties involved in the branch that it didn't completely close down Hell's Gate at any point when there were those microbursts of clusters. Ravensfort had fewer counties in it that had any significant population, so that did affect them. But we can look at that if it becomes a systemic problem. All right, so for the trend lines, and what this started out was a stoplight type report where green was good, yellow was, you may want to pay attention to see what's going on, red is stop. It started out as a much simpler process way back at the beginning because, well, we were in phase 1 at that point. We only had one option. So we've changed that with some of the logic. But for percent of population, I mentioned those earlier. So if it's less than 2 in 10,000, we figure that is an acceptable density. If it's more than 3 in 1,000, that's unreasonable. And that seems to be in alignment with Texas's guidance for closing down the Adler's Rue area just by complete happenstance. For the trend lines, if both of them are below 0, we give them a green. If their population is in the green and they've got a minor trend of 0.3, and how that number was come up was looking at a lot of graphs to figure out when I went from 0 to 2, what was okay. If I went from 100 to 105, what was okay, those types of things. There is not much statistical strength behind that. I tried to do all the regression testing and had challenges with that. So these numbers may get tweaked as we go through the process as we identify areas that need to be downgraded because these were too lenient or upgraded if they were too aggressive. With regards to the reopen dates, we're trailing by at least 2 weeks from the state opening. We may extend that a little further for phase 3 because of the recent protests and the massive reopening of services that happened at this time of year. But it automatically calculates in. These are the numbers that are currently defined by the CDC of their testing numbers. If you'll notice, Texas's do not quite align with the CDC numbers. That is because the CDC considers certain tests as less effective, but we're below the 10% mark, which is what the CDC wants you to be in, and our trend is going downward, so that is still in alignment with their direction. And then what we did with this originally was we made a stoplight type thing for all of them, and then calculated whether they stopped phase 1, phase 2, phase 3. From the feedback that the original chart that had all this data was too confusing to people, they just needed to know, could they go to practices or not, and what phase they were in. So we simplified that to just be what phase or stopped. Any questions about the data analytics? Oh, apparently I paused it. There, now you can see it. I don't know how I paused it. But this, originally, there were a bunch of stoplights, and these had stoplights, and that was just too confusing to people. So we went to a simplified, we're just displaying this on the website. For those who are interested in the analysis, the rest of it will be there. But we took a combination of, okay, these two columns make, so this one's green, we're at the highest phase it can be. We're trusting the trend line more than the percent of population when the trend is green. If it's red, if either of them are red, you're going to be downgraded at least one phase. If both of them are red, you are stopped entirely. So any questions about the data analytics? And having less people, this has definitely gone faster. So that's our branch question. So I'm now to open questions. Oh, come on, guys. You can't be that easy on me. All right, Eleanor.
Thank you again. This is a purely hypothetical situation, but as you know, we will not be able to have practices because of our marshal's situations. But according to the document, it says that 4 people or more can somehow get together and write into the upline to make a request. What would that involve? Would the upline send someone to us to hold a practice?
It is unlikely that they would send one to have a practice. They would evaluate the 4 people to determine if there is someone acceptable or not. And that's going to be a criteria of, are they already a marshal? Do they have enough years of experience between the group to be able to safely do all this, those types of things. We are not expecting at this point people to come in from outside groups to allow groups to have practices. Some people may do that based off Thursday night's meeting because they're trying to encourage it. For example, Rosenfeld, they have people come in from outside their branch to help them have practices and to train their combatants. But I don't know that we would have someone come in just to enable the group. Does that make sense?
Yes, it does. Thank you for the clarification.
You're welcome. Any other questions? Muriel again.
Sorry, I've got lots of questions. First of
it's
all,
all
thank you so much for all the work you've put into this. This has clearly been a big project, and I really appreciate it. Just a sort of a data question. Are you separating out, Texas is now reporting antibody tests separately from basic disease test, or do you have those separated out in your data?
I do not. I'm actually, except for that graph I showed you at the beginning, I'm not tracking the tests at all. I just wanted to show people that we are hitting that trend line. I am basing it purely off of new cases.
Okay, new cases as a percentage of population rather than test positivity.
That is correct.
Got it. Okay. Okay.
Which is probably more strict based off some of it, but I
sure,
don't
probably
have,
more reliable in the end.
Yes, exactly.
That makes sense. Thank you.
All right, Your Excellencies, Namron?
So you said that there is, this is just a plan right now and it's not implemented yet. Do you know when it will be implemented or a date when it's supposed to be?
We are going to be discussing it, I believe, Tuesday night. It is my hope to get it out next week, announce when we will be implementing it. I'll be honest, I kind of did some, I announced this in the way I did in order to get the reactions I did. Because when I announced it in the Black Star, I got no feedback. When I announced that we were doing a plan, I got no feedback from the populace in general. When I announced it on Facebook in the middle of May, I didn't get anyone reacting to it. I had been seeking people's input on the technicalities of it, the completeness of it, but had not opened it up to the larger populace yet. I sort of forced that issue by saying we're going to do this as early as June 8th, with the understanding that we would have some public outcry and that we would move it back a little bit. But my hope is to have it out here in the next week or two.
And then there'll
Otherwise,
be some kind of announcement whenever it is actually enacted.
that is correct. It will be spread as wide and far as we can.
Thanks.
Thank you. Your Grace Gabriel?
Hey, pardon me. Are you going to have any kind of official announcement for every change in a group status, or is it every group should just check their status before doing practice a couple of days in advance and the day of? Because an official mailing list or an RSS feed or something would be really great.
We've been asked about that and we're looking into it, but right now it was to put it on the webpage and have people check it. There will be an indicator of a group status change added to it. So if you went up or down or stopped, there'll be a clear indicator so that people have a visual indicator that something changed. But people have asked for some way to get it imported into other data feeds, so in a push sort of method. But right now it is set up as a pull method. All right, Patrick?
Yes, I know this is a stupid question, but will Crown Tourney be happening no matter what?
No, it is not a guaranteed at this point. Queen's Champion nor Crown Tournament are guaranteed at this time. We had to announce them in order, because of all the regulations of the FCA. As well, we needed to make sure we had sites reserved. Those sites are fully refundable. And we would not do it if we were not in phase 3 fully. So there is a possibility they will not happen. If we can't open the martial activities up early enough to get enough data on the safety of it, they could be delayed for that as well. Eleanor?
Thank you.
Thank you. At the beginning of this pandemic, group seneschals were granted the power to shut down activities in their groups prior to the states and the individual cities announced any such measures. Do currently seneschals have the power to veto fighter practices from occurring?
I wish Avery was on the call to answer that one specifically, but as we've discussed it so far, they may have the right to do it for a one-time type event, but not for a recurring perpetual type thing. One thing people need to be aware of is phase 3, even though the state of Texas and Oklahoma are in it, it could last years. It lasts until the pandemic is officially not a pandemic. So until the CDC changes that state. But we will be continuing to monitor our local groups' new cases and potentially reducing services or eliminating services based on that data.
Thank you for the clarification. I just have one more point to make, and it's that the barony of Bonwick comprises a large number of at-risk people. So I don't foresee people will want to be able to get together anytime soon.
Perfectly acceptable. We're not forcing people to come out. So, but what we don't want is to have a single individual prevent others from doing it across the kingdom. But if there are not enough participants, there aren't enough participants. It's that simple.
Thank you very much.
You're welcome. All right, is that everyone? Master Peter, for yours, that is part of why we have changed how we're reporting it. And if you look at the website with regards to, God bless it, too many windows. We are now only reporting the phase and not the data analytics that went behind the phase. So in the case of Bjornsburg, it is a phase 1, which means it's downgraded because there is some localized risk. But it is, so we would only allow the activities allowed in phase 1, which are fairly social distance activities. I don't know if there were other chat messages I didn't see, because I can't do all of it at once, unfortunately. Any other questions or clarifications? I want to thank you all. I'm going to be uploading this one to the Kingdom YouTube channel, just like I did the one for Thursday night, because there were some questions asked here that weren't there. This one will be easier for people to go through and listen to because it's not 3 hours long, and I want to thank you all for that. I do think the 3 hours was beneficial with 67 people present asking questions. I want to thank you all for taking your time to learn. Have a good day.
Thank you. Have a good day.
Thank you.
Thank you.
Thank you.
Thanks, Pug.
Thank you.
Thank you,
Now
everybody.
stop the recording.
Thank you, Pug.